To our Thursday webinar. My name is Lourdes. I am Director of Patient Services with the Cholangiocarcinoma Foundation. For today's webinar, as per the usual, please enter any questions that you might have into the chat or the Q&A, and please make sure to make your questions as general as possible. I'm happy to introduce our speaker today. Shelby Yaceczko is a doctor of clinical nutrition and advanced practice registered dietitian specializing in complex gastrointestinal disorders, where she focuses her practice on medical and surgical oncology care at UCLA Health. She is also the CEO and founder of FU Cancer Digital Health Company. Thank you so much for being with us today, Shelby.
Thank you so much for having me. I'll go ahead and share my slides so we can have an interactive presentation. I have a couple of slides where I might ask you if you're interested, you can dump your thoughts into the chat, the ideas, so we can have a little bit of interaction in the virtual setting, and hopefully you can be inspired by somebody else's thoughts or ideas today. And I look forward to spending some time with you. So today we're going to talk about nutrition and movement in cancer wellness. So this presentation and the kind of thought behind this discussion today is really the whole picture. So we're not just going to focus on nutrition, but we will focus on the big picture of cancer wellness and really tie in some of these major components that I bring into my practice. So just some disclosures. So I'm a doctor of clinical nutrition and an advanced practice registered dietitian nutritionist. I am not a medical doctor, so any questions that kind of pertain outside of my scope, I'll kindly let you know that I won't be able to answer that, or that you'll have to ask your physician or whomever you're under for your care. I practice at UCLA Health in our surgery in medical oncology and gastrointestinal digestive diseases team. And I'm also, again, the founder of FU Cancer. So I wanted to open it up with a couple of quotes, really just to start shaking up these topic areas as we move forward. And two quotes that I feel like I really resonate with, and I'm curious if you do. Number one is, let food be thy medicine and medicine be thy food. And number two, movement is a medicine for creating change in a person's physical, emotional, and mental state. So go ahead and think about those for a second or two. And if any of those kind of resonate with you, or you feel like, I love this quote, or maybe the opposite, this quote doesn't make any sense to me, feel free to drop your thoughts into the chat right now. Just as we open it up, and we're really going to be talking about this kind of holistic approach around nutrition and movement in the wellness spectrum. So it's important to kind of lay the ground just to understand some of the fundamentals and the basics of digestion as it relates to cholangiocarcinoma. So that way some of these things make sense as we go into some of the nitty-gritties. But just, I know some of you may know this, but as just kind of fundamentals here, cholangiocarcinoma can be localized, locally advanced, or metastatic, depending on the staging and other factors. It may or not be resectable, which can then change the ability of one to be a surgical candidate. There's different forms of treatment or how we help control cholangiocarcinoma. And there's treatment strategies including things like surgery, surgical procedures, chemotherapy, radiation, targeted therapies, immunotherapy, and clinical trials are all methods that may or may not be used in somebody's care plan. Going into the fundamentals, so there's different types of cholangiocarcinoma. So this is something, again, you can kind of speak with your care team and your clinical team if some of these things are new for you, or you're not sure where you kind of fall into these buckets. But each type may have differing treatment options, and it's important to understand that, because as each person kind of goes through their own journey, some of these different treatment options and these different modalities may have different side effects, or may lead to things, or may not lead to things that something else may have. So when we have a little bit of a clear picture of what our own kind of fundamental journey may look like, it can help lead to less surprises, or it can help us feel a little more empowered to understand our care plan. So because of the disease process itself, treatments that may be prescribed or provided, and side effects, it's really common to not feel super excited about food or eating. And a lot of people, the number one question I think I get in my group classes and in my one-on-one classes in my practice is, what do I do? What do I eat? What types of nutrients should I consume more of? Are there things I shouldn't consume? So a lot of the questions I get is really, and a lot of the doctors tell me that too. They're some of the main questions that individuals will ask them is like, what do I make for my loved one to eat, or um, should their diet or should their nutrition change? So, looking at some of this background and statistics, I think it's important to kind of look at these as a whole picture, but also as how they may apply on a one-on-one basis. So, big picture is more often than not, so more than 50% of the time, individuals experience some degree of malnutrition with gastrointestinal cancers. In the organs, if the organs that are predominantly responsible for digestion and absorption of nutrients are impacted, such as in cholangiocarcinoma, that can increase the prevalence or increase how often and to the degree that happens of things like undernutrition or malnutrition. So, malnutrition, when you go back to the research and we go into all the clinical side of things, we see that pretty big percentage of people develop a degree of malnutrition at some point during their journey. And so I'm a huge advocate of trying to help not only providers, but also individuals or patients or caretakers or loved ones start recognizing when these things may be happening to them. So we're not trying to kind of retroactively look back and treat malnutrition, but we're more focused on prevention of malnutrition or undernutrition, which can be really helpful for people in the long term. Malnutrition or undernutrition can be caused by both, the cancer itself in that disease process, but also just from the treatments, the medications, all the appointments, having procedures, all of these things can really leave a compound effect, and increase the prevalence or even worsen the severity that somebody experiences malnutrition. There is a diagnostic criteria, meaning that we know in the science side of things that there's like check boxes, if you will, of what we may or may not deem as someone having malnutrition. So there is like a objective criteria or diagnostic criteria. So that's why it's important too that when you're working with your providers or your care teams, that malnutrition is something that is on the radar for you. And it's being screened for you. And if things in your nutritional or your well-being status are starting to slide or go downhill, that you have a really strong plan in place, and you can recognize what are the things that are going to help treat the undernutrition or malnutrition that you may be experiencing. So, the cancer itself can compete with your body for energy and nutrients, can affect the ability of just basic digestion and basic functions, especially with digestion of food and nutrients. And it can also, unfortunately, as many of you may experience, really kind of mess with your appetite and mess with your hormonal regulation around things like your hunger cues, your fullness cues. I'd say probably, more often than not, majority of the time people describe, I just don't ever really feel hungry anymore, or I don't really ever have an appetite anymore. And that's hard to ask somebody like, eat, 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 you got to eat more. When you never feel hungry, right? That doesn't feel good to have to participate in. So recognizing these things and giving yourself peace, that this may be part of your journey, I think can be really helpful and empowering, as you try to reach your health goals. Different treatments can lead to different side effects, as I mentioned before, and this can really make it difficult to consume or digest enough energy and nutrients. So if you've got really low energy, you're sleepy, um, you're just not really feeling super hungry, you've got taste changes going on, eating a nice, amazing looking meal may not sound good to you, but it may sound great to your family. So when your family's maybe, really trying to encourage you and sit with you to eat, that can be annoying for some people or feel really pressuring. So we have to think about like the whole spectrum of what your experience is and how to best troubleshoot it. So that way things like malnutrition don't progress or we don't um the disease severity of the malnutrition can be slowed down or treated better. So malnutrition can happen from a couple of different factors. I like to use these like six little balloons. So inflammation. So when we have cancer cells present in the body, there's typically like a low grade level of inflammation to the cells that happen. And there's ways in which food can help support the reduction of inflammation, and food can support the increase or promote inflammation, which is what something we'll talk about later today as far as ways to help reduce inflammation in the body. We also can have altered metabolism. So, particularly with cholangiocarcinoma, we may have different digestion of things like some of our fats and some of our vitamins involved in those processes. And metabolism itself can change. And for some people, it speeds up, meaning we have to eat more in order to maintain the same body weight than we did before and the same muscle mass. During treatment, we may need to have more calories and more protein, specifically to help support the healing process and the recovery of the muscles in the body frame than we did before. And so it's learning these things as we go of what's going to make sense for you. Malnutrition can also happen from poor oral intake. We're skipping meals, we're sleeping through meals. When we do eat, it's much less than we used to eat. So just the inadequate oral intake or not having enough oral nutrients by mouth. Pancreatic insufficiency. So, for individuals, particularly who have gone under surgical resection for cholangiocarcinoma, such as in the Whipple's procedure, we see in the literature, more than half of people develop a degree of pancreatic insufficiency. In, the less pancreas we have, in theory, the harder it is to really pick up and absorb those nutrients. So, you may need to be screened for digestive enzymes or pancreatic enzyme replacement therapy specifically, which is a medication to help really with that breakdown and absorption of our main nutrients, particularly after a surgical resection. And if we are eating really well and we're not able to absorb the food properly, that can also lead to malnutrition, right? Micronutrients. So just in total, some people tend to gear towards certain food during their cancer continuum. So I know I've worked with patients before that like they only want to eat protein. They don't want to eat anything else because they're terrified of things like eating sugar and or having carbohydrates in their diet. Or on the contrary, I've worked with people who protein sounds absolutely awful to them, and so their diet is like predominantly just carbohydrates at the time. So the goal, really is that we've got to create some type of balance among our nutrients because once we start focusing too heavily on one food group or one type of nutrient, it can lead to vitamin mineral deficiencies, which is where this micronutrients bubbles come from. So the goal is, we've got to give our body all the things it needs to run properly. And that means getting a variety of nutrients, vitamins and minerals, and our micronutrients in. And if we don't, unfortunately, that can lead to things like malnutrition over time. And then altered motility. So the gut and all the digestive organs are responsible for like nerve conduction and this basic digestion process. And when we have any type of cancer to anywhere in the digestive tract, it can lead to like motility changes or the way food moves through food can look differently, especially when we have surgical resections in. So that can lead to altered way that the food absorbs and digests, which can then lead to malnutrition or undernutrition in some people. So these are kind of these six bucket areas, and I think it's helpful for people to kind of see like, hey, what are the areas that I feel like I'm struggling with the most? And kind of focusing on those at first to optimize those. Since we know that these tend to be like the six main areas that can contribute to malnutrition in individuals. Digestion 101. So just really bare bones basic here in case this is new for you. So our bile ducts really play an important role in the digestion and nutrient absorption, and they do this by moving something called ding 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 bile, which is in the name of the bile ducts, which is, that concentrated fluid that comes from the liver to the gallbladder to the small intestines, where it's mainly responsible for helping to digest and break down the fat that we consume in our diet. The gallbladder is really that little storage powerhouse site that stores all the bile. So think of it like your storage center of bile that gets produced by the liver and can help empty after a mealtime. So when we're starting to think about, well, how do I get started with this? I'm just trying to figure out where to go. This is kind of like my checklist that I use in a lot of my patient assessment referrals and conversations. First things first, we need to understand what your personal goals are. Is your goal, are you super focused right now? All you want to do is like gain weight, or is all you want to do is try to eat 3 meals, or you just want to feel better. You want your energy levels to increase. I think just identifying what your personal goals are can be really helpful when you're talking to your care provider, because that can help drive what interventions may be most helpful to you. Even if I have a different goal in mind than you might, I still value very much learning what your goal is, because you're more likely to hit your goals across the spectrum if they're meaningful to you. So sometimes just having that voice and being your own advocate and saying, hey, I love that you're telling me to eat more, but I don't care about that right now. My goal is to improve my energy levels. And so, how then I might phrase some of my education is more around your energy levels rather than kind of hounding you to eat more. So, making a list and identifying your personal goals, which we'll do in a bit today. Thinking about total calories or energy throughout your daytime. So it's really great to have one amazing meal, but one meal doesn't make up for your whole day's worth of energy needs. So nutrients to consider, one of which being like the total course of your calories or your energy throughout your day and how it's distributed. Same goes with protein. It's just really not enough to eat one meal a day with protein. We need to distribute out the protein throughout the day so it's meaningful to your body and your muscles to allow you to recover and keep you strong every day. Total fiber intake. Fiber is something that's so great for our digestive health and our gut, but also if we're having a lot of symptoms with foods that contain high amounts of fiber, we may need to either modify the type of fiber that we're giving you in certain foods, or we may need to really adjust, how the fiber is given. Do we want to think about blending some of these things or really cooking them to soft textures, or really distributing them in small quantities throughout the day to minimize any symptoms you may experience when you're already feeling um, pretty from your digestion tract is feeling pretty difficult to break food down, or you're having some digestive symptoms that are present, like bloating, things like cramping, or things like loose stools or diarrhea. So we've got to think about those things. Couple other things we always want to think about when we're kind of evaluating our nutrition plan is, are we taking any vitamin or mineral supplements? Have we had any deficiencies in the past? Do we think our diet is pretty well balanced right now, or have we been focused on the exact same foods every day? And last but not least, hydration plan. What does our hydration status look like, and what's our plan right now? And do we have a plan? Do we have a target with how we're getting in our fluids each day? You cannot forget, and this is so important, we can sit here and draw the most perfect plate and, come up with all the right colored foods and all of this stuff. But if you don't like it, it's not tasty to you, that's not fair to you. So we want to make sure that you're having food that you enjoy and that you find to be tasty and palatable. So this is my like 12-point checklist that I like to use, and I think it's a great reference for you to kind of take some notes and go through these things and kind of use it as your own kind of 12-point checklist, if you will. But really identifying, are you at a body weight and mass that you feel good at? Do you feel like you're too low for where you'd like to be or too high for where you'd like to be? Numbers on a scale are really just one thing, but I want us to think about that in the way of like what allows you to feel your best and feel your strongest. So really thinking about where that might be to help with driving some of your goals. Again, thinking about your hydration plan, which we'll break down in a few minutes. Considering eating smaller, more frequent meals rather than focusing on like one or two larger meals each day can help promote improved digestion and improve nutrition overall. Making sure that we're focused on getting a protein food in with our main meals. So we're distributing it out so it can be used better by the muscles in the body. Considering the use of liquid protein drinks, doing liquid meals, or even building things at home like doing smoothies each day. This is a great way to get in some supplemental calories that takes away the kind of side of it of having to do like a solid food meal every time you eat. That can be really annoying. Choosing foods that are easy to digest, foods that you feel confident in, that you don't feel like, oh my gosh, this is going to cause me bloating or it's going to cause me any difficult time digestion. Choosing foods that are going to have fiber coming from a whole grain perspective. So foods that are going to empower your gut to continue to support your gut, which also in turn helps support your immune health. Choosing colorful foods. So we want to focus on foods that have all different colors, not foods that just particularly come from whites or greens or reds. So we want to think about when we're looking at our plate, can we identify like two or three different colored foods on our plate? Or does everything look brown and white? Thinking about your healthy fat sources. So fat is something that I think some people totally avoid because they're scared of. But generally speaking, there's ways that we can sneak in some good fat sources that might be less difficult to break down and also help give you some calories and some energy for your body. So thinking about the type of fat sources, I would say is probably more important from my experience than the total grams of fat. So again, I like to focus on where does the fat come from rather than just like I want a low fat diet type of thing. We want to limit some of the added sugars and the sweets as being a main calorie source in the diet pattern. Keep an eye out for changes to your bowel movements or your bowel habits and be in discussion with your provider if you are noticing some significant changes. And last but not least, staying active and moving, which is so important. I have a couple of slides dedicated all on their own for movement of the body. So take a minute, kind of think about these. This is a lot. This is your 12-point checklist, but I think it's a really great start if some of these areas you haven't really thought about or explored yet. So my motto, the motto of my of what I do is really move, nourish, and thrive. So we want to move our body, we want to consume nutrient-dense foods, and we want to also focus on good stress management and mindfulness practices. So with that, I would love to hear, I know we've like briefly introduced some of these topic areas and we'll break them down just after this. I'm curious, what are some healthy habits that you're thinking about? And it can be something you've been thinking about for the last month. It can be something that you thought about today from my slide. Or it can just be, I don't want to have healthy habits today, and that's okay too. So feel free to drop in the chat if you have a healthy habit or something that you're thinking about incorporating into your lifestyle. I'll give everybody 30 or so seconds, and then we'll look at them later together. Got a couple of interesting ones coming in. Thank you for sharing for those of you Wonderful. And you might get some more inspiration as we move forward. We're going to break down some of these categories together too. So feel free to keep dumping in some ideas if they come up as we move forward. So these are just some examples of healthy habit categories. Things like planning ahead and organizing, hydration, movement, meditation, hygiene, nutrition, organization, and hobbies. So these are all different, healthy habits that may strike your fancy, or maybe an area that you're like, hey, I want to explore this. So hydration, as a reminder, majority of the human body is actually water. So over half of every single person in this Zoom calls um, body contains fluid and water, and is predominantly built up of that. So it's important that we have a hydration plan, which is really fundamental to your basic physiology functions of your body. Water helps promote good digestion, helps regulate your temperature, helps eliminate toxins and things, particularly things even from medications to help flush things out. Keeping hydration is really important to help with your energy levels as well as your concentration. If anyone's ever felt dehydrated, or you haven't had enough fluids throughout the course of your day, you probably will notice at some point you just feel like really tired, you want to take a nap. And that's something you can think about too, as if you're feeling tired quite often throughout your daytime, yeah, you might actually be like physically tired, but you also might be underhydrated. So that is really something to always ask yourself when you're feeling like overly tired, or it's been a little bit more of a difficult day. Ask yourself how your hydration has been that day. What I find to be most helpful is to split up your day into chunks. So you're not just saying I want to drink 8 cups of water every day. That's a good goal, but it also isn't really that specific of how we're going to do it. So what I like to do is have people break up their day into chunks. So maybe by noon, we have 3 cups of water. Maybe by 4 p.m., we have another 3 cups of water. In 2 hours before bedtime, we do 2 cups of water, or whatever that might look like for you from a breakout. So that helps distribute your water evenly, helps stop it before bedtime so we're not up urinating, but also helps ensure that really from morning to night, we're maintaining a more appropriate hydration status, rather than realizing it's noon and, oh my goodness, I haven't had a sip of water all day, and then we're already kind of behind. The best time in theory to drink your water is first thing in the morning. So within a half hour of waking up, having some fluids and hydration is a great way to get your day started, because you are the most dehydrated after you've been sleeping all night and have not been getting fluids, unless you're on like IV hydration or something overnight. But when you first wake up in the body, that's when you're like most dehydrated typically. So that's a great time to start your hydration plan first thing in the morning. Exercising. So now moving into the movement part of things. Regular physical activity is really a key habit. It's something we've got to think about each and every day. It helps strengthen things like your cardiovascular system, helps maintain your muscle mass or your muscle tone, and it also really can help with your mindfulness and your mental well-being through some of the different like hormonal regulations, as well as people's mood. That's a huge one. Is exercise is a huge mood regulator for many people. It's been shown to help promote enhanced treatment efficacy, improved quality of life during the cancer continuum, and also can help reduce side effects related to treatment. And I don't think we talk enough about this, because a lot of times we just talk about adjusting medications to improve, how your response is and all of these things. But we forget sometimes in the big picture that there's other factors that can also help with your own clinical journey, with physical activity being one of them. We know that somebody who's more physically active, they tend to feel stronger. They tend to have less things like falling or having this frailty picture. Um, they actually have less treatment toxicities when you go look at the research, and this because they're able to maintain more skeletal muscle mass versus the fat mass, which can help improve, how the treatments and some of the prescribed modalities work in the body. So it's really something to think about. The recommendations from the American College of Sports Medicine recommend the following exercise treatments for an individual undergoing cancer treatment. And this is between 150 to 300 minutes of aerobic activity per week, 2 days of resistance training, which means anything that uses our muscles. I want to say to a plug, if you have not or you have never exercised before in your life, tomorrow's not the day or tonight's not the day to go run a marathon for me. Make sure that it's safe for you to do. You don't have any functional limitations or anything. So check in with your physician and your medical team to make sure that it's appropriate for you or if there's anything that's specific to your own personal needs. These are just what we know from the research and the guidelines, and something that I also promote in my practice to those who it's appropriate for. This sounds like a lot, right? Like 300 minutes a week, like holy cow. So what I always think is a good place to start is I challenge individuals I work with to do 10 to 15 minutes twice a day, every day, to see what that looks like for them. So they can choose 15 minutes in the morning, 15 minutes in the afternoon. They can choose 10 minutes in the morning, 10 minutes in the afternoon, whatever works. But the goal is that we're just starting to plug in these times and allow the body to feel like this is a routine for them. And it's really hard the first 2 weeks. And I think it's important to remind ourselves that, like, the first couple weeks of doing any type of new physical activity can feel really annoying and like, oh my gosh, this is so much work. But it gets easier. And so that's one of those things to think about. It's a compound effect. Exercise during survivorship. There's a report from the 2018 American College of Sports Medicine, the roundtable around cancer prevention and control, concluding that exercise training and testing are generally safe for cancer survivors and that every survivor should maintain a level of physical activity. So it is something that's pretty universally promoted, and generally safe for individuals. But again, if this is new for you, check in with your care team before getting started. I just want you to understand the foundation and the why behind it. So moving forward to nutrition, eating well, eating the foods that your body needs to stay fueled can help decrease fatigue and side effects from treatments, whether it be surgery, chemotherapy, or radiation. In these steps, also having a nutrition plan in place can help prevent malnutrition or undernutrition. It's important to please work with your healthcare professionals. Registered dietitians are really the experts in the clinical nutrition world around oncology care. So if you have not touched base with a registered dietitian in your care plan, I encourage you to have a consultation, even if it's one time, just to get some information and see if there's anything that you could do to optimize yourself. The goal is really to help support healthy eating habits that are going to be beneficial to you on an ongoing basis to meet your health goals. I like to say these are like some of my main kind of takeaway points when I'm working with individuals. Make every meal count. So think about, especially if we're struggling to get in enough nutrients, don't waste your tummy space on eating a whole bunch of cucumbers if, you're barely eating. We want to eat the food and the meals that are really going to count for you to give you in that protein, the calories, and the vitamins and minerals that are going to be more nutrient dense for you to support your body. Take away the pressure to eat. If, Sally Joe is always calling and shouting at you to eat more nutrition, um, find what's going to be a more comfortable area for you, whether that be, watching a movie while you eat or listening to music or playing a board game or eating outside and getting a little sunshine or something like that. So like if there's something that's causing a lot of pressure for you to eat, let's redirect that and find an environment that's going to support you to eat better and eat in a way that's going to meet your health goals. And that means making it an enjoyable environment. So if you're like hyper focused on your food and you're just sitting there staring at it and it feels very kind of fear provoking or you feel like a lot of anxiety around your eating, we need to shake up your environment so it's more enjoyable. Try some fun challenges, whether it's with you and your friends, family, loved ones, whomever, your oncologist. Try a new recipe every week or try a new food every week just to kind of keep things going, but also give you a little bit of new nutrients coming in. Um, my rule of thumb is when in doubt, make a smoothie. You don't feel good, you don't feel like eating. That's okay. Let's not do solid food. Let's make a liquid meal that gives you the same nutrients or gives you the same benefit. So there's ways we can do blenderized meals or smoothies and give you what you still need in a form that looks different than a meal plate. It can be helpful to rotate liquids with solids. So if solid foods, again, really aren't working as well as they should for us, we can do some liquid meals and some solid meals and rotate them, which can help decrease fullness, and also just not feel so much like with fork and plate. Focus on eating the protein first on your plate. So when you have a plate of mixed food, if we're just eating like let's say we do some cooked veggies first or we're doing some potato or something, that might be great and those are great nutrients. But if that fills you up and then we're always like skipping the protein portion of the meal, even though we intended to eat it, if we didn't, then it doesn't count for your body, right? If you don't eat it, it doesn't count. So those are things to really think about is making each nutrition plan and your meal times count. If you're struggling with taste changes or altered flavor, use spices, herbs, dressing, marinades, etc. to really help dress things up. One of the biggest things I hear is like food doesn't taste the same. It's either plain or it's sour, it's too salty, or it tastes really bitter. And so there's ways that you can adjust the flavor profiles of your food to help with pulling the flavor out. This is particularly common with animal proteins. People experience taste changes. So it's important to understand what side effects you're experiencing because if you don't know them, then it's hard to troubleshoot them. So it's again having that awareness. Some eating problems that can occur for people are loss of appetite, changes in smell or taste, constipation or diarrhea, dry mouth or sore throat, nausea or vomiting, trouble swallowing or difficulty with swallowing foods, and weight gain or weight loss. So again, like identifying what are your priority areas so that way you can troubleshoot. There's a lot of really great resources, one of which is right here. So huge kudos to the foundation for putting this book together. I have fellow friends and colleagues who help write this book, and it's a tremendous resource. So if it's something you have never heard of or seen, you can log on and order your copy. That I think it can be really helpful to help you with troubleshooting things as you move forward. Hygiene. So some of these basic things that we can forget about, right, during our cancer care journey. So maintaining good hygiene is really helpful just to promote your overall health and well-being and how you feel. Hand washing is especially important for infection prevention and keeping things clean. Brushing our teeth regularly, right? If we're brushing our teeth only once a day or we're skipping, that can also lead to bacteria buildup, which can cause further taste changes or things like mouth sores, which can then impact our ability to eat. So all these things have like combined trickle effects. So if you're asking, why are you giving a slide on hygiene? It's because these things can all then go back into your wellness and well-being. And it really is that whole picture of like, if you're not brushing your teeth regularly, that can put you at risk of having bacteria kind of overgrowth in the mouth, which can lead to things like thrush or different kind of bacteria infections in the mouth, if you will, which then can alter how well you can eat. So these things all kind of go hand in hand. Organization. So, how organized do you feel right now? And is there different strategies that you might want to bring in place to help keep you better organized? This can help reduce your stress levels, increase your day-to-day efficiency, and give you more free time to enjoy the things that you do love. Hobbies. Engaging in hobbies is really a nice and great way to relax and unwind. So one question I tend to ask a lot of the patients I work with is, what do you like to do for fun? And sometimes you will just stare at me. But I think it's important to identify like what are the things, you're a human, like what do you enjoy doing? What are the things that bring you joy? So that can also impact your ability to eat. Like if you enjoy gardening or you like journaling, maybe you have your snack while you journal because you're more inspired to eat your snack because you're enjoying your journaling, you're enjoying your hobby. Gardening, drink your smoothie and do some gardening. So there's ways that we can integrate these things that bring you joy to help improve your nutrition status too. So goal setting time, if you've never heard of a SMART goal, it's really breaking down by the acronym of SMART. And it's having specific goals that are measurable, that are achievable, that are relevant, and that are time bound. So specific goals are going to be something that really outlines exactly what's to be done. So there's no room for ambiguity. There's measurable. There's a way that we can quantify the progress. Did this work or did this not work and why? They're achievable, right? If I say, hey, I'm gonna go to the moon tonight, that sounds great, but probably not achievable for me right now. So really making sure these things make sense for you and they're attainable and realistic. Are they relevant? If you're really, focused on something that may not be relevant to you at this point, or serve you or serve a purpose, then that's something that maybe we want to shift our mindset to a goal that's going to be more relevant and meaningful for you at this point in your care journey. In time bound, we want to set some type of deadline or something. So if you want to say, by the end of this week, I want to try 2 new vegetables, that gives you a time for completion. That I want to try 2 new foods or 2 new vegetables that I haven't consumed before. And I'm going to do that specifically by going grocery shopping on Wednesday. And then, you can measure that if you went grocery shopping on Wednesday. It's achievable. Yeah, if I need a caretaker to drive me, then it's an achievable thing. I'm able to get transportation to the grocery store. And it's meaningful to me because I realized after Shelby's talk that I eat the same vegetable every day. So that's like an example of a SMART goal. By the end of this week, I will consume 2 new vegetables. I will have my significant other, my family member take me to the grocery store on Wednesday. And then in 2 of my meals, I will consume my 2 new vegetables and I will share with my family my experience with the recipe. So that's like an example of a SMART goal. So I want you to think about, all of these different areas. I know we covered a lot in a short amount of time, but I want you to really think about what areas of opportunities you may have and think about even setting a couple of SMART goals on these different bucket areas that we talked about. And then I'll go ahead and open it up for any questions. And I look forward to seeing some of your comments in the chat.
Thank you, Shelby. That was a wonderful presentation. We do have a few questions already in. If anyone else has questions, feel free to put them in the Q&A or in the chat. Can someone have malnutrition if they are overweight or gain weight during treatment?
That's a really good question, and absolutely. So malnutrition is really just not defined by body weight or percentage in weight change, but it's also defined by things like your muscle mass. It's defined by things like your energy levels and your strength. And it's defined by things like the types of nutrients that you're taking in. And it's also defined by things like your fat mass. So we notice, usually when somebody's losing like weight unintentionally, the first place weight tends to go, even if the scale doesn't show a change, is in the face. So somebody's eyes might start looking more hollow, like their eyes are sunken in. Their temples, this temporalis area, might start caving in. And then we see usually more in like the collarbone and up into the shoulders area, the acromion bone here, which is this pointy bone on the sides, tend to maybe start poking out more than usual. And so let's say somebody who had a baseline weight of 200 or 300 pounds, that change or that unintentional change in their body composition may be less profound because there's more reserve at baseline, but that does not mean that they don't qualify for malnutrition. So it's something, malnutrition hits all body sizes and all body shapes, and nobody is immune to it happening.
Okay. Can you speak to the importance of vitamin D and ideas to address low vitamin D levels?
Yeah, that's a really great question. So really, the research around vitamin D tells us that there's a certain form of like the blood level of vitamin D that tends to be more specific. So making sure when you're looking at your blood levels of vitamin D that the proper form is ordered. And then with vitamin D absorption, if you're taking a supplement, or if you're prescribed a supplement of vitamin D, it's what's called a fat soluble vitamin, vitamin D as in dog, and it tends to absorb better when you have some type of fat with it, because that's how the fat helps absorb the vitamin. So usually with the vitamin D, if you have a prescription or you're on a supplemental supplement that's been discussed with your provider, having it with a mealtime that contains fat will help with the absorption. Um, if you have to again remind yourself, like, the bile ducts are responsible for the secretion of bile, which helps with fat digestion. And so some people may need to have a different amount of vitamin D than what we might prescribe a general population. So making sure that you're working with your provider to get your levels within typically the appropriate range. It may look different than a general population range though.
Okay. How can you make water more tasty?
Haha, I love that one. So, a couple things with water. If you don't have mouth sores, I think a really great way is to think about any of like the citrus-based flavors. We know that citrus tends to be one of the best ways to help with taste changes with like the bitterness of water. So I work with a lot of people that they'll put literally like a lemon a day in their water and use that, or they use orange slices or tangerines or whatever you prefer from a citrus flavor standpoint. You can always use like flavored ice cubes. So if you're not having cold sensitivity, you could get ice cubes that have like a like an orange juice type of ice cube or something and toss that into your water to disperse or to and freeze. So that's a way to help get in some stuff. So try different ice cubes if you can let those melt and go to room temperature. If you are having cold sensitivity, or you can always squeeze any type of fruit in there too, even like strawberry slices or something like that.
How does one test for digestive enzyme, vitamin and mineral insufficiency?
Yeah, it's a good question. So usually, so exocrine pancreatic insufficiency is what it's called. It's EPI. And that can happen with cholangiocarcinoma, non-surgical or surgical, more prevalent in people who have undergone surgery, specifically the Whipple surgery. And there are like stool tests that can be done that help understand how much the pancreas is secreting digestive enzyme, but it's not always accurate. So a lot of times what we'll do, and really what the updated guidelines say, is if you're meeting criteria for a number of the different kind of diagnostic criteria, we may start you on a digestive enzyme that's prescription, to see if that helps support you. So we're really looking at changes to bowel movement. We're looking at your digestive symptoms around food. Are you really gassy, bloated? Are you having loose, frequent stools or urgency every time you eat to have a bowel movement? Do your stools look like a tan color, clay colored, or much lighter in color? Do you have oil or grease in your stools? Are they floating? So there's a number of different things we'll kind of look through. But we want to correlate these back to food too. Do your symptoms get worse when you eat? So that's something you can talk through with your provider to see if it's something that may apply to you. But absolutely, if you've had a history of a surgical resection, like a Whipple surgery, you should be screened like every 6 months is what I do in my practice to see if somebody is like newly experiencing some of these issues around digestion. The second part of that question was screening for nutrition deficiencies. There's not like one best way to do this, but generally speaking, the accepted way to do it is through blood testing, when you're not actively inflamed or in like a hospital setting. So if your body's really stressed, when we draw your blood and look at your vitamins, it might not be as accurate. So I try to do it when somebody's in a little bit of a calmer state, if you will, with their body. They're not in the hospital recovering from surgery, or they've got a lot of inflammation, or they're in the hospital for sepsis or something. That's not a good time to look at your vitamins. We want you when you're relatively at your baseline, and then we can look at blood work and your vitamin levels.
Okay. Do you have any nutrition tips for someone who has undergone the Whipple procedure?
Yeah, so with the Whipple's procedure, it's a lot of kind of what we talked about, but I would say the other component we want to think about too is blood sugar control. So blood sugar control is something, if we have part of the pancreas removed with the Whipple surgery, blood sugar control as well as digestive support or like maybe needing digestive enzymes are two areas to think about. And distributing fat out, I think, is really helpful after the Whipple's surgery. So instead of having like one or two big meals with a lot of fat, that can be really tough with the new plumbing. But we want to space out and do like the smaller, frequent 4 to 6 meals, and then we have small amounts of good healthy fats. Things like avocados, things like nut butters, things like doing olive oils or avocado oils, as great ways to help give you calories and support because you need fat. Um, but in ways that we're avoiding some of the saturated fat foods, which can be harder to digest, particularly after the Whipple's surgery.
Okay. Have you ever heard of any relationship between the latest collagen peptide powder craze and causing cholangiocarcinoma?
That's a good question. And I think kind of to your point, you put craze. So anytime there's, kind of like a new suspicion or fad or something that we're bringing in, I personally, I'm somebody who, from a science background, I like to sit back and really understand what's going on rather than jumping on the train. So for, seeing that, I have seen some of the things around like the collagen powders and that. I think it takes a lot of time to understand concrete evidence. So right now, I think there's just not enough to really have a strong opinion on that one.
What if someone catches the flu or a COVID type virus and has a much harder time eating because of stomach pain and a hard time fighting the illness?
Absolutely. And so that goes back to maybe using some of those strategies like using the liquid meals or really getting dense meals. So one of the things that I think is like a really simple recipe or takeaway for you is, get some high protein yogurt, like a Greek yogurt, an Icelandic yogurt, which has much lower lactose typically, easier to digest. You can toss in some nut butter, whether that be some almond butter, or peanut butter, or something that's creamy, so it's broken down already for you, the texture. You can toss in a little bit of fruit, soft fruit like a little banana or doing something, even if you enjoy something like berry or something. And you can really blend that up, add a little bit of like ground flaxseed or something that's going to give small amount of fiber and calorie. Right there, you've got 400 or so calories in an 8-ounce cup. So there's ways that you can still kind of trick yourself to get in the right types of nutrients and enough, but not feel like you're doing so much effort and work, which is the biggest thing I think people experience when they're not feeling well is like the work of eating.
Do you have any thoughts on juicing? Is this a benefit or a potential problem?
Yeah, it's a good question. So I'm not a fan of juicing. I'm a fan of blending. So when you blend anything in the blender, you keep in all the nutrients and you keep in the fiber. And it's nice because it mechanically breaks it down for you in like a nice blender where it's a smooth, thin texture, kind of like juice. But you also get all the nutrients, vitamins, and minerals that the juice itself would not provide you. So I tell everyone toss out your juicer and get a nice blender.
Okay. Um, what if protein shakes high in protein are a little bit heavier on the stomach? Would you recommend the lower protein ones?
Yeah, good question. And I think it's really important that companies love marketing. So some of these protein drinks that are like 45 grams, 60 grams, that's too much. You do not need that much protein at one time. So realistically, most people need between like 15 and 30 grams of protein in one sitting, depending on their health goals on average. So if your protein drink is like 45 or 60, I would really question that's more than what like power lifters need at one time. How much are we really putting in right now? And is this too much for your body? And your body is trying to tell you it's too much. So if you're within the 15 to 30 grams, that's tends to be appropriate. And protein is only one important nutrient. It's not everything. So you also have to think about, again, the balanced approach and getting in enough total energy from other foods too.
How do you know if you need to increase uptake of creon?
What was that?
How do you know if you need to increase the uptake of creon?
Yeah, so first things first. So anytime you're using in the medication that she just described is a pancreatic enzyme replacement therapy medication. So the first thing is to figure out if you're taking it correctly, like the timing of your medication, if you're taking it consistently. Are you taking it every time you have your meal and snack? Or are we skipping often? So once we troubleshoot the basics, then we can look at like a dose adjustment. But it's not important to do, I find it's less helpful to do a dose adjustment right away if we're not taking it correctly or taking it consistently. So those are also things to really think about. And then you may have to do some altered dosing, which is what I do a lot of my work in helping people figure out like how much dose they need with certain meals and snacks and do more what's called dynamic dosing rather than like a fixed dosing where you take the exact same amount every time. So I think dynamic dosing can be really helpful for people. So it's more individualized to your meal times and your snacks.
I understand the general advice on limiting sugars and sweets, but is there any evidence that is particularly important for cancer patients?
Yeah, it's a good question. So the whole sugar feed cancer conversation, you could go down rabbit holes with this one, trust me. But so it's true, right? Sugar feeds every cell in the body, including cancer. It's a form of glucose. Any type of food or any type of carbohydrate you take in turns into glucose to feed the cells, right? But we know when we look at our human science and the research we have that if you stop eating sugar entirely or carbohydrates entirely, that the tumor itself does not like shrink from that or the cancer cells don't just die. It's unfortunately just not that relationship doesn't exist. So what we do know though is that when we have too much added sugar in one sitting, let's say we eat like big bowl of ice cream and donut, that can really increase the blood response of how much sugar just came in the body and kind of almost like shock the body. And so now we have all this sugar sitting in the blood that the cells have to pick up. So it increases what's called this like anabolic response to the sugar uptake or the glucose uptake. And so that's where we start seeing like there's increased inflammation that can happen with the body, or we can start developing more tummy tissue or that adipose or that tummy tissue, which can be risk factors to things like inflammation and things like chronic disease, including cancer. So the relationship is less direct than like sugar feeds cancer, but it's something where we want to, when we are having foods with added sugar, we don't have them as often. And we have them particularly not in like large quantity. We're going to have like large responses to glucose in the blood spike up. So I think that's something that I think can be important. So I have people who say like, "Can I eat a cookie?" And I'm like, "Yeah, of course you can eat a cookie, but don't eat like 3 cookies at one time and let's not do it every single day." So it's kind of like that approach I think can be really helpful for people.
Does undergoing chemotherapy make your body need more protein?
Yes. So that's a great question. Anytime you're going under like an anti-cancer treatment, including radiation or chemotherapy or surgery, you by definition tend to have higher protein needs. Not a lot, but usually you do have a little bit of extra, roughly like between 15 and 30 grams a day that would be needed to maintain your muscle mass. A lot of the anti-cancer modalities, they partly accelerate how much your muscles break down over time, and it's a compound effect. So like the longer you're on treatment, the more that compound effect happens, which is what's supposed to happen. But that also means you may need to continuously like scale your protein a little bit more over time to help maintain your muscles and your strength.
Okay. Do you have any food suggestions for individuals who have low platelets, white blood cells, red blood cells?
It's a good question. So low platelets, the research, just being really honest, is not super great in this area. But really what the research does says is making sure you're getting enough plant foods that contain your B vitamins, specifically like your folate. So your leafy greens, potentially some of your nuts and your seeds, doing some good protein sources, which all help with like cell health and development. So when in doubt, most most answers to questions around nutrition are eat more plant forward types of foods. So, fruits, veggies, nuts, seeds, beans, legumes, all of these things help with reduction of inflammation. They support immune system. They can help support your blood cell health, etc. So majority of the time, the answer goes back to like, look at your plate. We want at least, roughly 75% coming from whole plant focused foods, majority of the time as a way for like whole body health.
What are your thoughts on incorporating holistic healing and nutrition options such as colostrum or soursop tea?
It's a good question. I think it starts getting spotty because a lot of these things are not regulated. So I am probably more conservative in my approach where I don't encourage people to always take the risks, especially being immunocompromised or immunosuppressed. So I think there are ways that you can support immune health and support your body to heal using whole foods in a way that we know has strong evidence behind it, and is regulated, right, with like the food system itself to some degree. So not I don't really recommend any particular like dietary supplement or some of the different things from the naturopathic world. I try to really focus on like the whole food plant-based picture for health and well-being.
Perfect. And then, do you have any suggestions for managing increased nausea due to chemotherapy?
Yeah, yeah. So there's different ways from nausea. There's things like ginger, there's things like doing like miso soups. I also think it's really important to understand if you're sensitive to smells or temperatures of foods. So if something's really like offensive to you with the cooking, that can really exacerbate smell. Or if something is too cold or too warm, that can also exacerbate some of the side effects or the symptoms around nausea. I also think it's important to make sure that you have in what's called our anti-nausea plan in place. So some people will have prescriptions for anti-nausea medications that they haven't tried or they're not using routinely. So work with your healthcare team so you have like an anti-nausea plan in place. And if it's not working, you need a plan B or you need a second plan. So there's ways to get through treatment to reduce your side effects or your symptoms, including things like nausea, but it has to be dynamic and you have to bring it up and talk to come up with what's going to work for you.
Perfect. Thank you. I know we're at time and I want to respect your time. We had a lot of questions, a lot about different types of foods and ideas on snacks and things like that. We'll probably have to do another webinar just on that. So thank you so much for this presentation. It's been really informative. I think everyone really enjoyed your talk. So thank you.
Amazing. Yeah. And I just saw one thing in the chat I wanted to say. So somebody wrote 300 minutes a week. How am I supposed to do that? So again, break it out. And it's the recommendation's 150 to 300. So aim that initial goal at 150 and break it out. You can do 5 minutes here, 10 minutes here, 10 minutes here. You do not need these long 1 hour sessions to have a benefit. So look at your day and look where you can squeeze in some new healthy habits.
Thank you, Shelby. I hope you have a great day. I hope everyone also has a really great day.
Amazing. Thank you all for being here with me today. And thank you for having me to the foundation. Take care.
Take care.